Hey guys, this is Dr. Hub. Today we are looking at the vulvar cancer and its staging. So to begin with, the stage 1. So what is this stage 1 related to? So the stage 1 is where the tumor is confined to the vulva. So stage 1, simple, it is where it is confined to the vulva. So in terms of 1, there is 1A and there is B. So what is A? A is when the lesion. So this A we refer it as 1A and 1B respectively. So 1A means the lesion is less than equal to 2 centimeters. So it is less than equal to 2 centimeters in size and it is confined to the vulva or the perineum. So this is confined. So it is confined to the vulva or the perineum. So it is confined to the vulva or the perineum and with a stromal invasion that is less than equal to 1 mm. So there is also a stromal invasion. So there is a stromal invasion and this invasion is nothing but less than equal to 1 mm and there is no nodal metastasis. There is no nodal metastasis. So now let's compare it with 1B and check the difference. So in terms of 1B, it is simple, that is, it was less than 2 cm in size. Here it is going to be lesions greater than 2 cm in size. So lesions with greater than 2 cm in size and they have a stromal invasion greater than 1 mm. So in the 1B it was, everything was less. So stromal invasion was less than 1 mm. Here it is stromal invasion that is greater than 1 mm. Next is, it is confined to the vulva or the perineum. Next is, it is confined. So it is confined to the vulva or the perineum. Vulva or the perineum. And it has a negative nodes. It has negative nodes. Then we move on to 2. So 2 refers to the tumor of any size. So it can be any size. And there is an extension to the adjacent perineal structures. So it extends to the adjacent perineal structures. So what does this mean? So this means that it is a lower 1/3. So it may be lower 1/3 of the urethra. So lower 1/3 of urethra and the lower 1/3 of the vagina as well as the anus. And this is with the extension to the adjacent perineal structures with negative nodes. So there is negative nodes. Next we move on to the type 3. So in terms of type 3, it is a tumor of any size again. So it is any size tumor and they can be with or without the extension into the adjacent perineal structures. So it may be with or without. So with or without the adjacent perineal structures. So we are writing as PS. And what do you mean by adjacent perineal structures? This is just as we discussed. So it is a lower 1/3 of the urethra as well as the lower 1/3 of the vagina and the anus. And this is with a positive inguinofemoral lymph nodes. In 2 there was negative lymph nodes, negative nodes. Here it is going to be positive. So here it is in type 3, it is going to be positive inguinofemoral lymph nodes. We are writing it as IFLM. Then we move on to type 3A. So what is type 3A? 3A, it is again divided into 2. So 3A1 and 3A2. So 3A1 means that there is a 1 lymph node micrometastasis. So it is 1 lymph node that is a macro. The macrometastasis. So macrometastasis is anything which is greater than 5 mm. Next we move on to type 2. Type 2 means it is a 1 to 2 lymph node and it is micrometastasis. Micrometastasis is less than 5 mm. So when you're looking at 1 lymph node macrometastasis, it is greater than 5 mm. So as the number increases, the lymph node increases, but the size decreases. So in terms of 382, we are telling that there are more number of lymph nodes. There is 1, 2, but the size is smaller. Now we move on to type 3b. So what is meant by type 3b? Type 3b, it again has 1 and 2. So 1 refers to the with 2 or more lymph node macro metastasis. So you are telling 2 or more macro metastasis. And what do you mean by 3b2? 3b2 means 3 or more lymph node macro metastasis. So 3 or more, it is micro metastasis. In terms of 1, it is macro metastasis. Now let's look at the 3C. 3C is nothing but it refers to the positive nodes. It is nothing but the positive nodes with the extracapsular spread. So there is extra capsular spread. Then we move on to the type 4. So what happens in type 4? So type 4 is where the tumor invades the other regional structures. So it invades the regional structures. So what do you mean by regional structures? We refer to the upper 2/3. So upper 2/3 of the urethra, the upper 2/3 of the vagina, and other distant structures, or the other distant structures. Now we look at 4A. What is meant by 4A? 4A, it invades any of the following. So 4A, 1, it stands for the upper urethra. So it is a upper urethra or the vaginal mucosa. Next is the bladder mucosa or the rectal mucosa. Then there is a fixed to the pelvic bone, or it is fixed. Fixed where? To the pelvic bone. Now let's look at the 4A2. The 4A2. So in terms of 4A2, it is fixed or ulcerated. It is fixed or it is ulcerated. So it is fixed or ulcerated inguinofemoral lymph node. Inguinofemoral lymph node. Then we look at the 4B. 4B refers to any distant metastasis including the pelvic lymph node. So it is DM, so it's better to write the full form. It is the distant metastasis and we include the pelvic lymph nodes. So we are very particular including the pelvic lymph nodes.